Hello everyone, welcome back to our next recall session. So today we're going to discuss with you about recall questions of anatomy of NEET-PG 2021. So let us start our discussions. So the first question is a patient presented with vision loss on radiological investigation and aneurysm causing damage to the optic chiasma was noted. Which of the following arteries is most likely to be the artery that is causing the damage? See here, aneurysm is there which causing damage to the optic chiasma is noted, and which of the following arteries is most likely to be the artery that is causing the damage? So aneurysm of the optic chiasma is mostly due to the anterior communicating artery that will lead to the vision loss symptoms because that is causing the damage to the optic chiasma that compresses the optic chiasma. So the answer here is A, anterior communicating artery. The next question is a 34-year-old man presented with fever and massive splenomegaly. On palpation, the spleen was 15 centimeter and directed obliquely when measured from the right iliac fossa. Which of the following structures prevent the vertical and downward descent of the spleen? So here they are suggesting vertical and downward descent of the spleen. So vertical and downward descent of the spleen is prevented by the action of phrenicocholic ligament, which is extended between diaphragm to colon. So that prevents downward descent of spleen. So the answer here is C, phrenicocholic ligament. The next question is identify the papilla from the given histological section. So this is the histological section. The papilla that is given in this histological section is largest papilla of the lung, and that is known as circumvallate papillae. That is actually situated in the posterior one third of the tongue, and they are 8 to 12 in number. So the answer here is B, circumvallate papillae. The next question is 7-year-old boy was brought to the hospital with multiple fractures of the humerus secondary to a fall from height. On examination, there is difficulty in flexion of the elbow and supination of the forearm and associated loss of sensation over the lateral aspect of the forearm. Which is the nerve most likely to be injured? So there is difficulty in flexion of the elbow and supination of the forearm as well as associated loss of sensation over the lateral aspect of the forearm is there. So there is muscle involvement as well as there is a skin involvement. So it is actually due to the involvement of musculocutaneous nerve. That is lead to the difficulty in the flexion of elbow and supination of the forearm as well as associated loss of sensation over the lateral aspect of forearm. Okay. So musculocutaneous nerve is the nerve that is responsible for these muscle and sensation defect. The next question is a patient presented with jaw swelling and weight loss. Suspecting a malignancy, the submandibular gland was resected Which is the most likely nerve to be damaged during submandibular gland resection? They are asking the most likely nerve to be damaged during submandibular gland dissection. It is actually the lingual nerve, because lingual nerve that winds around submandibular duct. So during the submandibular gland resection, that is the nerve which is most likely to be damaged. Okay, so the answer here is C, lingual nerve. The next question is, a patient underwent a coronary bypass graft with the great saphenous vein. The patient now complains of paresthesia and sensory loss over the medial aspect of the leg and foot. Which of the following nerve is most likely to be involved? So they are describing the sensation of paresthesia as well as sensory loss over the medial aspect of the leg and foot. Medial aspect of the leg and foot is actually supplied by the saphenous nerve. So the nerve most commonly involved here is B, saphenous nerve. The next question is, during the clinical examination of the nervous system, which of the following nerves can be tested by touching the highlighted structure? So the highlighted structure in this head and neck cross section is uvula, and the uvula is supplied by glossopharyngeal nerve, which is the ninth cranial nerve. So the answer here is A. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.